Well, a warm welcome to today's talk. It's Tuesday, the 29th of June. Everything was a bit of a rush yesterday in those brief interviews that we did. So I wanted to go over these things just between you and me now, so we've got a bit more time to do it. Now, basically, I've been thinking about this overnight and putting together what I was talking about in those interviews yesterday. There is a bit of a pessimistic picture, actually. Not so much for Europe, the United Kingdom and the United States. Things are still looking pretty good there. Maybe a slight proviso there. The United States, the Delta variant does seem to be doubling every 2 weeks in the United States, and it's currently well over 20%. So this could be an issue in the States. We're kind of waiting to see on that. There's certainly going to be more cases of Delta variant in the unvaccinated people in the United States. There's no real question about that. But let's come on to that in a minute and look at the global context first of all. Now, we've had this increase and gratifying decrease that we know about, but now this is global cases. We think we probably are starting to see an increase now. That does seem to be genuine. And the Delta variant is definitely in at least 85 countries, probably more actually, but identified in 85 countries. Now, this number is going to go up, and it's going to go up quite dramatically. The question is, will it be shown on the graph or not? This is from our, can't remember what it's from. It's Our World in Data or, World Meter. This one's from World Meter. So the cases will be going up, but a lot of the new cases are going to be in places, as we've looked at recently, like Bangladesh, Pakistan, where the testing is low. So the official number of global cases is probably not going to represent the actual number of cases because of low levels of testing in many of the areas where the pandemic is about to have really quite bad effects due to this Delta variant first identified in India. So that is the cases. Now, deaths-wise, again, we do see a flattening out in deaths at the moment. And unfortunately, we're probably going to see this sort of classic linkage between cases and deaths that we've been used to from the United States and the UK in many other countries, because the linkage is not being broken by vaccination. And we've also looked at quite a lot of data on this channel and many other channels, many papers now, about the possible efficacy of ivermectin for preventing spread. Now, there is evidence that this is likely to be the case, but I really don't see it playing a big role in this current wave in many countries, unless local governments make statements about that, about the ivermectin situation. So it'll be interesting to see how governments around the world call that shout. Whether they are going to be using ivermectin as they did in several Indian states, for example. So basically, for most of us, vaccination is going to be the protection rather than chemoprophylaxis. Of course, in my view, everyone in the world should have an optimised vitamin D status. But whether we're going to see drugs to act as a prophylaxis having a big role in many countries, perhaps not. Let's hope governments are looking at this now and actively considering it. And of course, antiviral preparations are being produced by quite a few big pharmaceutical companies as we speak, although I'm not expecting those to be inexpensive, unfortunately. Now, Delta variant B1617.2, 64 increase chance of household transmission compared to the Alpha variant, data from Public Health England. So we're talking about more than double as transmissible compared to the wild variant. And of course, we know that the Alpha UK Kent variant was already more transmissible. And some early data, some tentative data coming out of Germany on this, the Robert Koch Institute, which we're going to hopefully get something more definitive soon, but some tendency to increase hospitalisations on Public Health England data. Limited data on that now, more to come. I think what we can probably say is it's unlikely that the Delta variant is going to cause less morbidity than the Alpha variant. So it could be the same. It's looking like it might be a bit worse. We need to wait and see. talking about unvaccinated people. Now, Public Health England data that I gave, that's on that link there is the Public Health England data. This is quite interesting in terms of vaccine efficacy, and the news is good for people that have had 2 vaccines, but of course the vast majority of the world has not. And this is becoming, really, this Delta variant is becoming a superimposed pandemic on the world. It is now quite literally, in every sense of the word, pandemic. Increasing in many places weekly, doubling weekly in many places, slower in the United States, as we've said. And of course, we also know that the Delta variant is at least 95% of the cases in the UK now. So talking about the Pfizer-BioNTech vaccine first of all, and the Delta variant, this is from Public Health England now. Now, it is less efficient than it was against the previous variants, about 6% for the Pfizer vaccine. Now, efficacy against symptomatic disease, Pfizer vaccine, 1 dose, 36% protection against symptomatic disease, 2 doses, 88% protection against symptomatic disease. But of course, we need to remember that that's not 100%, so that leaves 12% of people that have had 2 doses of the vaccine who could still get some disease. And that means they could be shedding the virus while they have that disease. Now, the odds are they're going to get a much shorter duration. It's going to be a much milder course. They're going to get less clinical features, but they're more likely to get headache, runny nose, sore throat and sneezing than they were before. So people with these symptoms, even if they've had 2 doses of vaccine, must consider the possibility they have the infection, that they're at risk from passing it on to others. So they need to get tested and to isolate appropriately to protect those around about them. So that is protection against symptomatic disease. Effective against hospitalization with the Pfizer-BioNTech, 1 dose 94%, 2 doses 96% effective. So presumably this means that hospitalizations will be down 96% in populations that have had 2 doses of Pfizer vaccine, as long as they wait for at least 2 weeks after the second dose, of course, to get the full immune effect. Now, the Oxford AstraZeneca data, slightly different. This vaccine seems to be working a bit slower. So the efficacy figures for the Oxford AstraZeneca vaccine could carry on improving, actually. But these are the data that we have now. This data actually came out on Monday, the 28th of June. So it's pretty up to date. But AstraZeneca, Oxford, Delta against the Delta variant, 1% less effective after 2 doses, so that's good. Now, efficacy against symptomatic disease, 1 dose of the AstraZeneca vaccine, 30%, 2 doses, 67%. So a greater chance that someone could still get symptomatic disease, albeit very likely to be milder, shorter duration and less clinical features. But that high index of suspicion is needed just in case they're passing the virus on to other people. Effectiveness against hospitalizations, 71% after 1 dose and 92% after 2 doses. But these figures may well carry on increasing for some time yet. So they may actually get better and may well reach sort of parity with the Pfizer-BioNTech vaccine. It just takes a bit longer to develop the full immune response. So we see very good protection against hospitalisation. Now, another thing I've been asked about quite a lot is the so-called Delta Plus variant. We don't know too much about this at the moment, but let's have a quick look at that. It's reports of a more infectious sublineage. Now, query more infectious. We don't have firm data on this yet. It may turn out not to be more infectious, but it may have an element of immune escape. Now, it's sometimes called the AY.1. Now, what this mutant has, this variant has, is it has the same mutations as the Delta variant, but it's got an additional mutation as well as that. And that an additional mutation is this one. It's the K417N. In other words, the K amino acid has been changed to the N amino acid at the 417th amino acid position on the spike protein. And the problem with this is the mutation that's associated with the South Africa variant, the beta variant, and that is has been associated with immune escape. So more to come on that. Basically, that's all we know at the moment. We can't really speculate further. Now, let's look at some background information before we go on. Now, these are new daily confirmed cases in the UK. Now, the Delta variant is starting to take hold in Europe. We know it's about 15% or more in Germany. Next week it could well be double that. Italy, we're not sure. France has certainly been seeded with the Delta variant, as has Belgium. Spain, we believe, has, although we don't have firm data. Portugal definitely has. And of course, the UK, unfortunately, is 95% Delta variant at the moment. So Portugal is starting to follow the UK now. Portugal, France, Germany have been seeded directly from India to some extent, but Portugal's also been seeded from the UK from people going on holiday, which is rather unfortunate. Now, what this means with the increased transmissibility of the Delta variant is we probably will be seeing increasing cases in all of these European countries. They could well be following potentially the UK or the Portuguese sort of increasing trend because of the transmissibility of the Delta variant. Let's look at the factors here. COVID-19 vaccine doses administered per 100 people. So the UK is ahead. So we expect it to have the least impact in hospitalisations in the UK. Now, the United States sort of neck and neck in terms of per capita vaccine with the UK. But now the UK has gone ahead, but the vaccine hesitancy or vaccine apathy in the United States has resulted in a lowering of the increase in the United States. Belgium, Germany, Spain, Italy, Portugal, France, all increasing in vaccination, but not that high, not as many people as we would like doubly vaccinated. So we're certainly going to see an increase in Delta variant cases in these countries and some increase in hospitalisations, but they're probably vaccinated enough to keep the hospitalisations manageable. But the United States really does need a bit of a wake-up call as far as the Delta variant is concerned, because it could well be 25% there now. We're not really sure. It was 20%. It was 20% a good few days ago now. So it's a risk for the states, no question about that. So that's the vaccination status. Now, this is a review of English-speaking countries. Now, I've rightly been asked to include South Africa in English-speaking countries because it is largely an English-speaking country. So Australia, New Zealand. Now, Australia, a few cases, more on that later. New Zealand still low. Canada going down. United States pretty well flat. Ireland pretty well flat. United Kingdom up dramatically. And South Africa up dramatically. Now, this is a concern in South Africa. It's winter time there now. People are indoors. They are closing the doors, rebreathing each other's air, of course. And this is the Delta variant that's got to South Africa. So that is a concern. Let's look at the UK in more detail first, though. So cases yesterday on Monday in the UK up 22,868. The day before on Sunday it was 14,876. So we have a dramatic increase in cases in the UK, as that graphic has just told us. Deaths, thankfully, not 11 deaths reported on the day before, 3 deaths reported yesterday. Total deaths in the UK, 128,000. Hospital admissions, again, up somewhat, another 227 on the 24-hour period. And this is 1,505 people in hospital currently in hospital with the Delta, with all cases of coronavirus in the UK. 95% at least of those will be the Delta variant. Past 7 days in the UK, cases are up 69.9%. Deaths are up, but still on a low level, from a low base. So 122 deaths in the week. So I'm not putting too much anxiety on that at the moment because it's still at low levels. Admissions, as we say, up 10.3% on the week. Adult vaccination rates, first dose 81%, second dose 61.6%. But this, of course, in the UK data is only those over 18 years of age, not the whole population. So this is what Sajid Javid is now looking at, the cases in the UK and the vaccination, and is going to be making his announcement today on the opening up on the 19th of July. And Sajid Javid, our new Health Secretary, we won't talk about what happened to the last one. The new Health Secretary is very, very keen on reopening, as indeed is the Prime Minister. So I'm expecting quite a significant reopening on the 19th of July. So Sajid Javid, new Health Secretary. The latest modelling from Public Health England shows that they've saved over 27,000 lives, talking about the vaccines, of course. Saved over 27,000 lives and have prevented over 7 million people from getting COVID-19. Wow. 27,000 lives saved and prevented over 7 million cases. So that's the report, his report on the vaccination programme in the UK. 2 doses of the vaccine are just as effective against hospital admission with the Delta variant compared to the Alpha variant, Sajid Javid said. Now, he said this yesterday. So this is more up-to-date data than the Public Health England data we've just looked at. But as we see, there's a bit of a tension here. Sajid Javid saying it's not more likely to be hospitalised. Public Health England data saying that there is a slight risk of increased hospitalisation. Robert Koch Institute seeming to indicate a slight increased risk as well. So we need that clarified, but we can expect that Sajid Javid, even though he's only been in the job for a few days, is well informed, and he wouldn't have made that statement lightly. So that's looking promising. 2 doses of the vaccine are just as effective against hospital admission with the Delta variant compared to the Alpha variant. So talking about the vaccine programme there, looking encouraging for the new variant. That's good, very good news. While cases are now ticking up, the number of deaths remain mercifully low, so my bet is he's going to announce opening up on the 19th of July. Germany, as we've said, 15% at least Delta variant now. Limits on travel from virus variant zones such as Portugal and Russia and the UK has been introduced, but Germany at risk from the Delta variant clearly. Now, Australia, lockdowns in Sydney, Darwin and Perth due to the Delta variant. More on that later. We're going to getting a report from Nigel, Dr. Farrier in Perth, so we're going to leave that for now. Portugal, of course, as we've seen, quite a big increase in the Delta variant. Travel in and out of Lisbon banned for 3 days. The numbers are going to go up. Russia, the Delta variant. Moscow, this was Sunday, 144 deaths just in Moscow. Underreported, of course, it always is in the Russian areas so far. Maybe they'll improve their reporting at some point. But that's the highest since the start of the pandemic. Vaccination in Russia, 1 dose of the vaccine. Well, 14% of the adult population's had at least 1 dose. Very poor, largely due to the poor public relations, or rather the public relations disaster, really, that the vaccine was introduced with in Russia. Pity, because we believe that the Sputnik vaccine is effective. We just need more people to take it. St Petersburg has hosted 6 Euro 2020 matches, another one on Friday with 26,000 people attending. The Delta variant is so contagious, there have been some cases of transmission at football matches confirmed by the authorities in Denmark. Let's hope this is not a super spreader event. It is outdoors, but the Delta variant does seem to be spreading even outdoors, whereas the original variant wouldn't. Africa, Delta variant. 14 countries with exponential growth in Africa. Don't know what variant it is in most of the African countries, but we do have more information on South Africa in a minute. But it looks like this third wave in Africa is the worst so far. Cases and deaths in Africa generally up by 40% over the past week, although it's hard to tell, but there's definitely an increase. Africa's protected by its younger demographic. It's hindered by its untreated comorbidities such as hypertension, obesity and diabetes. And the Delta variant is definitely in South Africa. 18,000 new cases in the day. Vaccinated status in South Africa, 5%, very low. It's winter, it's cold. This third wave in South Africa is going to be the worst wave in South Africa so far, as it coincides with South African winter, because of course they're in the southern hemisphere. Other countries in Africa, Uganda's already struggling for oxygen. People are going to be dying through lack of oxygen like they did in India and, I'm afraid, in other African countries. Indonesia, population is 276 million. They now have the Delta variant. Increase in travel, mass gatherings, post-Eid celebrations, increased transmissibility of the Delta variant. This is going to be a real problem. So what we're seeing is things are getting more cases in the UK, but things are getting better. But quite a few other countries are heading in for the worst part of the pandemic so far. And it's going to be quite bad in some of these other countries that have low vaccination rates. So we are going to see hate the term first world, third world divide. It's going to be the vaccinated world doing reasonably well. The unvaccinated world is going to have, I'm afraid, it's quite depressing really, a potentially likely to be devastating third wave, driven by the more infectious Delta variant. Just trying to think of a positive spin to put on that, but it's kind of hard really. Health services in these areas are very, very, very badly stretched. Bangladesh going into a week lockdown, people are going to literally go hungry. It is a bad situation for countries with low vaccination levels. Now, on vaccine news, there's some good vaccine news coming out actually at the minute. There's some new news that I'm going to report on soon about the longevity of the immune response from the vaccines. It's looking like it is going to be years and decades. Looking very promising, as indeed we had anticipated, I must say, on this channel. The question is, are we going to need booster doses? Not because so much that the immunity generated by the vaccine has expired or run out, but because of the variants. That's the question. So the first modified vaccine work has been done here. AstraZeneca and Oxford University are doing this work. Trials of a modified coronavirus vaccine. This one's designed to act against the beta, that's the South Africa variant. 2,000 volunteers being recruited in the UK, Brazil, South Africa and Poland, which could constitute a possible booster vaccinated for fully vaccinated people. But of course, having designed the beta variant, it's now the Delta variant, which is the big problem. But we are understanding and thankful that these people that are designing the vaccines can modify them to the new Delta variant fairly quickly, and they may well need to do that. We don't know, but I'm sure work's been done on that as we speak. Professor Andrew Pollard, Oxford University Vaccine Group, talking on this. He said he's testing the system against making vaccine variants. So he's not saying this is massively needed. It could be useful, but he's testing the system. So he's basically demonstrated that they can tweak the vaccine. Really, really good news. So the vaccine, again, could be readily tweaked to the Delta variant. He says there's no immediate urgency around the Delta variant. Well, I don't quite agree with Professor Sir Andrew Pollard there. I think there is in many countries. Now, if he's talking about the UK, then he's... No, let's be fair. I think he's talking about the UK there. So if he's talking about the UK... Of course, I'm not going to disagree with them. Of course he's right with the UK, because we've looked at the good vaccine efficacies from the Pfizer-BioNTech and the Oxford AstraZeneca vaccine that we're already using. In terms of the rest of the world, which he wasn't thinking about, of course, it's not the case. Already the Delta variant has caused havoc in India and is doing so in other places. So no immediate urgency in the UK, which is good. Other countries, poorer countries, unvaccinated countries, a massive emergency need. Much more about being prepared for this quiet testing variant, the South Africa one, and also future variants. So really, why I'm reporting this is proof of principle that these clever people, brilliant people that make these vaccines, can modify it, but it's not going to be done quick enough for billions of people around the world who are now going to suffer greatly in the third wave, I am afraid. And we see South Africa somewhat leading the way there. How much we'll ever know about this because of low levels of testing, we might never know. I mean, in India now, you've probably seen these upsetting pictures on the news. Hundreds, if not thousands, of bodies being washed into the river from the floods in the Ganges. The Ganges has flooded. Many poor people buried their relatives by the Ganges, indicating that there was a lot of unrecorded deaths in the countryside as the Delta variant ravaged India. Many people couldn't get the medical help that they needed, and I really feel that this could happen now in many countries over the next few months. And yesterday on these interviews, one of the presenters asked me what we need to do, and the answer is we need a moonshot here. You know, people can work together and they can go to the moon. They can work together on a Manhattan project and make a nuclear weapon that was unimaginable a couple of years before. We can do this. The UK is making 700 million vaccine doses this year. We need to coordinate the science with the politics, with the sheer humanitarian need that is here, because many parts of the world are just in desperate need of the vaccine and are going to suffer greatly without it. Death rates could be high, much higher than normal. They could easily be up to about 5%, because people the 5% that would have gone to hospital and would have been saved, many of those in poorer areas are simply going to die from simple lack of medical care, as they did in India, and that is what could potentially happen. So we really need a global concerted effort, and I'll leave you to decide whether you think we're going to get one or not. On that note, thank you for watching.